me a little bit about the symptoms that you were having before you had the UFE procedure.
But before I had the procedure, I was always bleeding. I was in a lot of pain. I just kind of normalized it, that it was just, I'm just getting older and it's part of just having a cycle. And I finally realized that this is not normal. It ended up becoming a part of my profound anemic. That's what they said I had, profound anemic. And I had to come over to oncology a lot to get blood transfusions.
Wow.
And also, I can't think of the other thing, iron transfusions.
Okay. Tell me about how it's changed your life.
Oh, it's been the best thing. I no longer have to jump up. I used to have to take the first breath of my life and jump up and take a low dose pill just to keep me from bleeding in the morning, a low dose hormone.
Okay.
I have a lot of energy. I no longer have to go get any iron transfusions or anything like that. So my doctor's happy about that. Life has just changed. I just feel amazing.
Tell me what you would say to a friend or a family member who is also struggling with fibroids and is trying to figure out what to do about it.
I would tell them to stick to just learning about your fibroids. Don't go to the first thing about knowing what we were always raised to do as far as going to a hysterectomy, because there's so many other procedures like this one that I had, and it was easy, and it wasn't a surgery, it's a procedure, and it's the best one for you. Just do your research. Get a second opinion if you have to. Your doctor's trying to push you to get a hysterectomy. No, you need to come and get this procedure done. You'll be out of the bed within 24 to 72 hours.
Awesome.
A great time.
So tell me what surprised you the most about uterine fibroid embolization with the Fibroid Institute.
What surprised me the most was the fact that the doctors was just so like what you would have back, what you dream. I'm almost 50 years old. What I thought doctors would be back in the 60s when they made house calls. The follow-up care was so wonderful. A personal cell phone number, I can call her now. She actually, once she became to be my doctor, it became to be a Facebook friend. So I love that about the whole thing, and that just the care that it takes to know that someone else cares about my health the way I would supposed to do about mine. They care more about my health than I did myself.
Was there anything that made you nervous about doing the UFE procedure?
Trying to believe that what the procedure was of actually going through your wrist. You kind of have a hard time trying to believe something could actually go through your wrist and go to your vagina area and take care of something in your uterus.
Right.
And that was just shocking. It's just like, what? It's like us, driving, parking, and having a car that parks itself.
Was there anything hard about it?
There was nothing hard about it. I went in. They saw me. She talked to me about what she was going to do that day. She said if she had any issues, she would get it back out. I woke up. They said, "Hey, Miss Stevens, everything is okay. You're ready to go home." I went home, followed the chart like she said. I was up within a couple of hours. My little boy came home, and I was ready to cook him something to eat. I could have went to work, but I didn't. It's well worth it, the journey, to be able to come and get this done. Women of color, any women, decide to do what the right thing that you need for your body. And these women really do care about, they're passionate about their jobs and the things that they do, and don't settle for second best, settle for the best. And this is the best place. The Fibroid Institute is the best place to come to.
Thank you so much.
Thank you for having me.